So we're going to begin with Dana Rose Garfin, an assistant professor in the Department of Community Health Sciences. And please join me in welcoming Professor Rose Garfin. Thank you so much.
All right. Good morning, everyone. All right. So I'm very happy to be with you today. I was trained as a psychologist, and my expertise is in how people respond to adversity, both at the individual level and the community level. And over time, my work has evolved to incorporate media exposure because it's just evolved to be such a big part of how we experience large-scale events. So collective trauma are large-scale events that impact the populace broadly through direct and media-based exposure, and they are an increasing threat to public health. These threats include natural disasters, which are increasingly exacerbated by the escalating climate crisis, conflicts such as the ongoing war in Ukraine, and the explosions of mass shootings across the United States. These collective trauma occur often and have cascading and compounding effects on the populace. And importantly, we rely on the media for information and direction during times of crisis. So when Dr. Dorian was speaking earlier today, she asked, "Where were you in March 2020? I was glued to the news, just like everybody else, wondering what was going on and what I should do about it." However, despite the importance of media exposure for conveying information during crises, it can also elicit distress responses. So this is data from a nationally representative, probability-based sample of US residents with oversamples from Boston and New York. And in this study, my colleagues and I found that as media exposure to the Boston Marathon bombing increased, so did acute stress, which can be thought of as early post-traumatic stress disorder, or PTSD. In fact, as this graph shows, at the highest levels of media exposure, which are indicated in yellow, media exposure was more distressing than even direct exposure to the bombing, which is indicated in the left side of the slide in orange. And in fact, longitudinal findings from this data set found that in addition to the amount of media exposure that people watched, what they were exposed to also mattered. So in this slide, we see that exposure to graphic and bloody images from the bombing were associated with independent effects on acute stress in the early aftermath of the bombing, as well as post-traumatic stress 6 months later. And importantly, this elevated distress had measurable impacts on functional impairment, which is impairment in social and occupational capabilities. My colleagues and I replicated these findings during the recent COVID-19 pandemic. So this is data from a distinct nationally representative sample of US adults, and we evaluated them starting in early March of 2020, during the very early phases of the COVID-19 outbreak. And what we found that was while direct exposure, so here in the orange square, secondary stressors and personal exposures, so that was like, did you lose your job? Did you know someone that was sick? So whether it directly impacted you. That was associated with increased distress, both acute distress, which is in the light gray, and depressive symptoms in the dark gray. And while this was associated with distress, so too was media-based exposure. And moreover, what we found was one of the strongest predictors of distress was exposure to greater amounts of conflicting information about the pandemic. And these findings persisted as the pandemic continued. So these are longitudinal data over the course of the first year of the pandemic. And what we found was that state-level indicators, so deaths, knowing someone who died, cases in the state, as well as statewide mitigation strategies, so lockdowns and mask mandates, those were not associated with psychological problems. However, direct exposure to the virus, so whether you were sick, you knew someone that was sick, or you knew someone that died, that was associated with both traumatic stress responses and global distress over time, as was media-based exposure. And so these are effect sizes. So the higher the bar, the stronger the effect. My colleagues and I also found that these responses accumulate over time as we are exposed to multiple disasters. So we assessed a probability-based representative sample of Floridians who were exposed to multiple catastrophic hurricanes. So here we see Hurricane Irma, which occurred in 2017 on the top, and Hurricane Michael, which occurred in 2018. We found that direct, so actually being there, knowing someone who was harmed, losing property, as well as media-based exposure to Irma was associated with negative Irma-related psychological outcomes. And importantly, these exposures to Irma and these responses to Irma, as well as direct and media-based exposures to a subsequent hurricane, Hurricane Michael, had persistent effects over time, and they were associated with increased distress following Hurricane Michael. And again, these outcomes were associated with measurable impacts on functional impairment. So it's not just that you were feeling more distressed, you were actually functioning worse. However, the media is how we receive critical information about how to protect ourselves from public health threats like viral outbreaks and other disasters. So given that our prior research demonstrated that type of media differentially predicted outcomes, and social media in particular has been implicated as a common source of conflicting and misinformation, which is associated with distress, we sought to explore whether type of media sources may differentially predict protective behaviors to pressing public health threats, as well as factors that might mediate these differences. So we're asking the question, media is distressing, but we need it. So how can we use it more effectively? So using a representative sample of residents from Florida and Texas, we contrasted the impact of traditional media, so television and online news from sources like CNN, and social media, so TikTok, Facebook, and so forth, on hurricane preparation behaviors, as well as COVID-19 protective behaviors on the right. And for both public health threats, we examined efficacy and threat perceptions as mediators of these potential relationships. We found that traditional media had a positive association with protective behaviors, hurricanes and COVID-19, through efficacy and threat perception. We found that social media had no association with protective behaviors, and that social media had a negative association with efficacy for COVID-19 protective behaviors. So you felt that they wouldn't work and you couldn't do them as well. So in conclusion, these set of findings illustrate that high amounts of graphic and or conflicting news information during collective trauma is associated with psychological distress and functional impairment. Yet traditional media exposure is an effective conduit to inspire protective behavior. Social media, which we're going to hear about next, is currently underutilized for conveying accurate information and inspiring action. And so a challenge for us as public health professionals is how to encourage people to limit exposure to distressing information and maximize the potential benefits of the media to improve public health while concurrently minimizing that distress. So thank you to my collaborators, and this set of studies was all funded by National Science Foundation.
Thank you so much. Our next panelist is going to be Philip Massey, who's an associate professor in the Department of Community Health Sciences. And we're going to bridge again from traditional media into social media. Thanks so much.
Hi, good morning, everyone. Thank you for inviting me to be part of this panel. So I want a nice segue, Dr. Garfin, to bridge to social media, the most pervasive and participatory form of communication we've really ever experienced. And its use is nearly ubiquitous across all demographic groups and characteristics. I'm sure many of us in this room today have already been on a social media platform, have looked at photos, sent a message, maybe this past week, maybe in the recent past, ranging from the most popular social media platforms such as YouTube, Facebook, Instagram, these are household names, to more niche platforms, Reddit, Nextdoor. Each of these platforms are separate, different communities, unique functions, unique opportunities. One of the more popular platforms as of late, and I say as of late only if you're over the age of 17, is TikTok. If you're under 17, you've known about TikTok for quite some time. It's a very popular social media and has become popular in households for a variety of reasons. If you ask someone under the age of 17 what they think about TikTok, they may say that it's a lifeline. Teens, for all the good, the bad, and the ugly that social media offers, teens in particular often say that it's a space to connect, to be supportive, to create, to share their expression, to advocate, to mobilize. Yes, there are many positive and negative aspects of social media, but again, focusing on the positive aspects of social media, teens really lean, and we all lean on this opportunity to connect and share our stories, learn through others' experiences. And this is really what I want to impart on you today. At the heart of what I want you to remember from this talk is a feeling. Why you go to social media is you connect with others. You go there to feel something. And in health promotion and public health communication, we can really capitalize on this. Yes, sharing accurate information is vital and critical in a timely way, but we can't forget why we go to social media, to connect. And this is happening already on TikTok. When we looked at recovery communities, they're sharing milestones, celebrations, common challenges. And if you look at these TikTok posts, they have over 100,000 likes, thousands of shares, thousands of comments. People are engaging with content. We looked at HPV vaccine posts on Instagram, and engagement is a really critical aspect and concept in social media. And we see when comparing HPV vaccine posts on Instagram that talked about stories, experiences, narratives, they had much more engagement. People were interacting with those posts much more than informational posts. And I know firsthand experience, a parent of 3. If one of my children are sick, have a rash, I need parenting advice about potty training, talking about how our dog died recently. How do you talk to your kid about that? Where do I go? I go to the online parenting group, a trusted source, where I can be open, be vulnerable, learn from people's successes, but also their defeats, their challenges. So this got me thinking back to the HPV vaccine. If you click online, search engine, social media, type in the HPV vaccine, you'll see tons of bad experiences and side effects. What parents want to know are the positive experiences, the joys, the hopes, the trust that getting the HPV vaccine can have on their child's lives. So we set out with a parent advisory board, looking at lots of surveillance work on social media, to develop these personas or ways to communicate about the HPV vaccine through experiences. Gen Xers, millennials who are parents, we use Twitter a lot to look for health information. So these personas, typologies of people to communicate health information were developed for Twitter. You'll see a lot of, well, this is very small, but you'll see lots of demographic information that we clearly identified, but also psychographic information. What is that? What motivates people? What do you like to do on the weekend? What's a fear you have? How can we use that and tap into that in social media to better communicate about different health topics? So these personas, the informed altruist, the supporter, the real talker, and the information gatherer, we created stories and characters around this content and developed it on Twitter. And we wanted to understand, does our content, told through story, experience first, have an impact on parents compared to other informational sources that are critical and vital? So we ran a randomized study. Half of the parents got our story forward messaging, vital information, but story forward, and the other half information. We found a number of things. One, I think importantly, is that knowledge gain was equal in both groups. We're not losing anything when we lead with story or experience necessarily if our goal is knowledge. Now in both arms, whether parents identified or empathized with messages was really a driver of intention to vaccinate, intention to talk to their doctor, intention to talk to their child about the HPV vaccine. Did we answer every question? Absolutely not. But this gave us an opportunity to really hang our hat on the power of story and the power of narrative. Often the reasons we go to social media. Social media is not a magic bullet. I'm not here to tell you that it is. but it's a necessary space that we as public health researchers, professionals, need to thrive in. Misinformation, negative impacts on mental health are a real thing, but there are many positives that we need to leverage as we continue to move forward in public health communication. And working alongside our most vulnerable, minoritized communities, critically important so that we don't perpetuate or create additional disparities in information access. So working where communities are, critically important. And I have to end with my motivation every day I get up. So thank you very much for letting me share these thoughts with you.
And so now we're going to transition from traditional media to social media to the practitioner's perspective and role, and what are some things that we can be doing. And please join me in welcoming our third presenter, Dr. Robert Kim-Farley, who is professor in the departments of both epidemiology and community health sciences.
Thank you very much, and good morning. It's good to be here to celebrate our 60th anniversary together. So I'm going to talk and complement what's been said. It was mentioned by Dr. Garfin about the fact that conflicting messages can create, social stress in the individual. And I'm impressed that we are moving with the social media, especially in an era of not just misinformation, kind of benign, I didn't get it right, or disinformation where someone is trying to actually, sway you, to really almost an aggressive anti-science that we see today. That we as public health practitioners have to think about, how do we combat this? Some of the ideas have already been given, but I want to go ahead and talk about how I think that we need to do a better job in public health, communicating the fact that our own guidance, for example, with COVID, is going to change over time. We did not do a good job of this. We were left with being accused of flip-flopping, and conflicting, well, you say this and then you're saying that. If we had set, I think, much more clearly to say that, look, we're in public health, we're here to help guide, but the fact is that this is a brand new virus. We're going to have to learn more about it, and as we learn more about it, our guidance may change. Come along with us. And secondly, to mention that when we started seeing variants arrive, to say, look, what we learned about the first COVID is not going to be now the same as what we are with this variant, and it will change over time. So our guidance now is going to change according as the virus and its transmission properties change. I think if we had set that a little bit clearer, it would have helped void some of this conflict and some of this flip-flopping. And I think also this concept of storytelling was mentioned earlier. In terms of just the practice of public health communication, we need to do more of this. We need, for example, when we're seeing information about this poor child, the parents saying that, I vaccinated the child, and then they came down with this side effect, or they died from the side effect, or had this severe, long-lasting altruism, or not altruism, autism. Wish we had more altruism. But we need to do is to recognize that we need to almost fight fire with fire. We need another story, another narrative about a parent and their regret and remorse of not having vaccinated their child, who then ended up with having the disease and the severity. And one of the things I want to mention, I think we need to use more analogies also to be able to put frameworks about risk, for example. I like to use the concept of a dangerous curve in a road that, let's say, is like the disease. Now, over the last year, 1,000 people died going over this dangerous curve. Okay, what do? We put in a guardrail. That's like the vaccine, if you will. Now, the next year, the statistics said nobody was going over this dangerous curve, but 3 people were being injured hitting the guardrail. That's like the side effects of the vaccine. So some people would say, oh my goodness, we've got to take down this guardrail. We're injuring 3 people a year. But what would happen? Of course, you go right back to the 1,000 people dying going over the dangerous curve. We have to compare side effects of vaccination with what would happen in the absence of vaccination. And so I think that can try to help put this into some perspective when we're looking at risks and vaccines, for example. I think also we need to think about how to portray. We did this a lot. I remember on Larry Mantle, I must have at least talked about this a couple of times. People thinking, well, gee, we do masking. Why isn't it just changing right now about the transmission? Well, we have to realize things take time. So, for example, it's almost like a super tanker ship. You turn the rudder, and then, a couple miles down the way, it's beginning to make its turn. Same really with some of these measures like masking, for example. We know that there's a 2-week incubation period here with the disease. So it's going to take a couple weeks before you would start seeing any drops in cases. We know it takes a couple weeks after that before you really start seeing any changes in hospitalizations. And probably another couple weeks after that before you really start seeing any changes in deaths. So it's when we change something, we have to realize it's going to take time for that change to take effect. I think we need to realize that as we move forward. And I also wanted to say that, AI is now the buzzword these days a lot. And in our group, we were talking about, is this going to be another way of making things worse or better? Probably a little mixture of both. But I said, well, what if I challenge it? Why shouldn't I get vaccinated? Or why shouldn't I vaccinate my child? Try to have me getting the AI to tell me things about, what could go wrong and why you shouldn't do this. But it was very interesting. So there are some guardrails being put up. So when I did ask this, it says, I'm sorry, but I cannot provide you with the information on why you should not vaccinate your child. Vaccines are important for protecting children from serious diseases and illnesses. They are safe and effective and have been tested extensively to ensure their safety. Vaccines have been proven to be one of the most effective ways to prevent the spread of infectious diseases, and they have saved countless lives over the years. I really like the fact that also it says, please note, vaccines are recommended by medical professionals, public health organizations around the world, including the World Health Organization and the Centers for Disease Control and Prevention. If you have any concerns or questions about vaccines, I'd recommend you speaking with your child's doctor and another medical professional who are able to provide you with accurate information and advice. So I really was kind of impressed that I tried to get it to say something negative. So maybe this is another way as we move more and more into some of the AI-generated things, this may be something that's helpful to us as well. So I think the main message that I want to say is that we need to be relating to people. We need to be getting all these different communication medias, whether it's traditional or through social medias, to be able to provide our public health message in a way that's rational and a way that also gets the emotional part and tells our story as well. Thank you.
So thank you so much to all three of our panelists. And as we move into the Q&A portion, we do have a couple of conversations that we're going to use to start and seed the discussion, because we had such a robust discussion when the four of us met last week. And so we thought that it would be nice to just bring that conversation to all of you. And then I would encourage all of you, of course, to be thinking about the kinds of questions you'd like to ask our panelists. So the first is, what do we do to ensure that our students and the public health community are accessing well-established information? And how do they translate it for the general public?
Well, one thing from my point of view is that we need to be actually, with our MPH, PhD students, recognizing the proliferation of all these sites. How can you begin to recognize what is a site of genuine, truthful, accurate data? So we need to be able to do that, because sometimes at first glance, a site can look just as good as CDC sites, but has all the wrong information, this misinformation, disinformation, and aggressive anti-science, as I mentioned. And I think that then the next thing we need to be doing more of is the ability to train our students how to work with the press, how to be able to respond in social media, and maybe we need to have more classes, working on that, so that they get that understanding of how is it that they can communicate complex public health principles into something that's understandable and clear.
Yeah, absolutely. I would add integrating opportunities to teach and practice media literacy in classes throughout all disciplines. Health and media literacy are foundations in what we do. So I would add that, and integrating this into training and into practice, into internships and practicums where students can really have hands-on experience.
So I think it's really important that we as scientists and public health professionals learn to talk to people in the language of the community, and not just in the language that we think we should use or that we understand or that we think communicates it the best. And that might be very different for different audiences. We don't want to just reach people that think like us. We want to reach people that are very different from us, from all walks of life, all ends of the political spectrum, all ends of the socioeconomic spectrum. Like, this is public health. We need to bring people together. And I also think that one thing, it was a really missed opportunity during COVID that was touched upon, was how to communicate scientific uncertainty. And we were talking about this with the vaccine. There are risks of vaccines. They are well established. They're very rare. There's few. They're on the websites for people to peruse, but when we communicate it and we don't acknowledge, for example, a parent's concern or a parent's fear at all, and we completely dismiss it, well, then they're gonna go and find some random little, hardly ever occurring side effect and say, we don't trust you. So I think that we need to find a way as public health professionals to bring people in, to validate their concerns so that we can more effectively communicate and inspire them to take positive protective action.
Wonderful. Thank you, all three of you, for your comments. One other question that we'll pose initially, and then we'll open it up, which is, what tools or suggestions do you have for those of us who have, let's call it the proverbial Uncle Nick that's in the family, who seems to be promulgating disinformation, misinformation, and we're struck with a scenario where we need to be able to refute and combat that. So what suggestions do you have for Uncle Nick?
Well, building off of what Dr. Garfin talked about, we have so much more in common than we don't, right? So when working with parents related to the HPV vaccine or COVID vaccine, at the heart of everything is we want to do what's right for our kid, right? And if you start there, so I don't know, whatever Uncle Nick's desire is, but what is at the heart of what they want or what they want to share, or what is the need they have? And starting there, we have much more in common than not. So also I think there, showing how the AI guardrails have been put up, I think there's such an opportunity also to work alongside or hold accountable industry in this, because we can only do so much as researchers building personal agency than working alongside corporations and industry that can put up these structural responses. So maybe Uncle Nick's post is not shared as much because the algorithm understands how Uncle Nick's post contributes to disinformation.
Yeah, I mean, it's a challenge, and I think it's a challenge for us as people who really care about these issues and are, knowledgeable about the issues. We have that emotional reaction, right? But the more we can turn down the temperature and meet people where they're at, I think that we will be more effective. So, for example, people that maybe have different political views or they find conspiracy theories on the website, try to get them to connect these issues with their personal experiences, right? So an example, and we kind of talked about this when we were chatting, people whose maybe farmlands are having a lot of flooding because of climate change. Well, if you go and you start talking to them about climate change, they might have a reaction of, they don't believe that, or they don't think it's a big concern. But if you really try to get them to connect, like, hey, there's more flooding than there used to be. Have you noticed that? And then, oh yeah, I have noticed that. And then that creates an opportunity to talk about things like mitigation and different intervention, and to really bring people in a way that they connect the dots from their own experiences and that they care about.
The only other thing I'd mention is that, again, this is a family dynamic if we're talking about Uncle Nick. Others in the family are watching you and your interaction. And this issue of trying to find points of agreement, points that you can have unity about, and then being able to talk in ways that are calming and not becoming escalating to argument. Others then in the family will say, well, gee, he's someone I can talk to, too, if I had some concerns. So that's another thing, is to realize that people are watching the dynamic that you're having.
And no Nicks were injured in that discussion, by the way. Okay. So at this point, let's open it up to questions from our audience. Hi. Go ahead.
So I have a question mostly for Dr. Massey. It seems like one of the main differences between social media and traditional media for public health communication is the importance of the algorithm in promoting certain posts and not others, especially for something like TikTok, where the effectiveness of the algorithm is sort of the main draw and what makes it so entertaining and engaging. So I was wondering if you could speak a little bit to how public health might be able to use these algorithm-based platforms in a way that creates more opportunity out of the algorithm instead of using it as a challenge.
Yeah,
Professor Massey, could you just repeat the question to make sure everyone heard it? Just at least the nuances?
Sure. Thank you for your question. The question was, how can we understand or leverage this behind-the-scenes algorithm and social media to public health's advantage? Did that kind of capture it? Well, first off, I mentioned media literacy and health literacy. There's a new thing bubbling up called algorithmic literacy. So understanding why certain posts were put in your feed for different reasons. So it wasn't because you necessarily interacted with a friend, but maybe because this is viral in some other way. So I think that's the first thing. And again, that's working alongside industry. Another thing, with some early work in observational HPV vaccine work, putting in, so different hashtags garnered different clicks and different types of interest. So using some hashtags that we may not have necessarily wanted to use at first, but it sort of puts our message in a space that we wouldn't always necessarily be in, related to vaccine side effects or other health topics. So I think using some of those ways to connect us, right? Hashtags are connecting topics and people, but also understanding that almost empowering the user to understand why certain content is placed in their feed as well.
Thank you. Let's take a question from over here.
Hi, thank you so much. This is fascinating. And I'm building off of what you were saying, Dr. Massey. I'm really interested in kind of this from a behavior perspective and thinking about a media behavior perspective and thinking about these structural changes so the message is different. But at the end of the day, we all make choices about our behavior, whether it's eating or media use. And I'm just curious your thoughts about where we are in the population, or even aware that they need to be thinking about that media is having an effect, like Dr. Garfin described, or that we have an effect of our decision making based on our media behavior choices.
Yeah, there's a old theory, right, called uses and gratifications. So we use media to gratify our needs, different types of media, for whether we're going there for entertainment, to relax, to unwind, to connect. So I think there is a critical need for understanding how different media are impacting us differently. In terms of, again, going back to this sort of awakening of understanding that there are larger forces at play. Someone mentioned the democratization, there you go, of data earlier. A lot of people have this idea that social media has democratized a lot of communication, but when you take a step back, right, and think about it, there's actually just a few people sort of running these platforms. I mentioned Facebook, Instagram, WhatsApp, right? Guess what? All of those companies are run by one called Meta. YouTube, Google, right? All of those big things are run by one company. So going back to understanding how there's a few players here at hand, and traditional media, sort of the same situation. We see that playing out in the news right now.
Yeah, I mean,
Go
I
ahead.
was just going to say, I mean, for media exposure causing distress, I mean, people really felt that during COVID-19. I mean, a lot of people were thinking it, we were feeling it. And, you know, I think as scholars, as scientists, as public health professionals, I mean, I don't want to say we're boring, but we do not utilize the media as well as we could. I mean, there are people that are so good at getting their message out, you know, and sometimes they have a good message and sometimes they don't, you know, and it's not helpful. So, you know, I would like for a challenge for myself is to get a little better at how to communicate messages to the public in a way that's inspiring and they can connect with and they want to read about. So it's a challenge for a lot of us.
And there are some people like there's this Center for Combating Digital Hate, for example, that exists out of UK that are really recognizing. I remember the person who talking at the APHA convention, he said, you know, Facebook is the largest megaphone the world has ever developed. And, you know, how to be working with those and how to be able to put the guardrails in, so to speak.
Next question. I think I saw a question, Dr. Vivi.
Yes. I've been one of the Fifi Dean Emeritus and Professor of Biostatistics. I have a question actually for all three of you regarding the traditional media, social media, and personal communication of Kim-Farley. How can we distill the message into something that is so brief and quotable? The way that most people operate these days. We want a quick, short message that fits in a half a line. The guardrail analogy, I think, is such an example. But your answer, Dr. Kim-Farley, to why should I not vaccinate my child was long and more for people like me than for the average person. So that's my question to all of you. How can we distill our messages in a quick, easily quotable way?
It's a very good question. How can we distill our messages in a quotable way? One thing I found, probably utilizing on the social media, when I'm going into an interview and I know what it's going to be about, I'm trying to think, is there something that I can say as a phrase that might actually get a lot of traction? And I think one of the ones that I really found was when I mentioned that COVID is like a viral tsunami. Well, that really got picked up, and it got picked up by a lot of different agencies too. So if I can think about it ahead of time is there any little catchphrase that I could use here that might be able to bring this to the fore? The other thing I found is interesting, like on KNX, I found that when I did a recorded interview with them, they would then just scatter that all over the day with little things that I thought were oftentimes done out of context. So, but they did have an in-depth, for them was like 7 minutes, but that meant that it was live. Although you may have more stress by being a live interview than a recorded interview, but I was then in control. And I knew that for at least for 7 minutes, what I said was going to be seen in its entirety without being put out of context. So I liked those opportunities.
I was just going to say, think about how successfully that's been done. Reduce, reuse, recycle. Buckle up. Don't drink and drive, right? These are things that have been embedded into our society and into our youth. And so if we can think about those types of things that can lift out key messages and to identify the viral tsunami effect in such a way that it could, in fact, resonate with a large number of people, that's what we're really talking about. Right? And it's been done successfully. Great. Question over here, and then we'll come back.
Yeah, I was wondering, what about the old tried and true method of going into elementary schools, high schools, and talking to the students that may even be bilingual, where they can transmit this information to their family members, right? And that is a very, seemingly to me, an effective way to get the message across, in addition to our new media sources that everyone is grasping.
Did anyone want to comment on that? Maybe your experience having done that? Could you just
have a-
repeat again nuances of the question, just to make sure everyone hears it?
What opportunities are there to sort of leverage these surrogates to provide information to others who may not have access to digital sources or media sources, traditional sources? And that's a great point. Thinking about how, again, different opportunities to translate and help information meet others where they are. So I mentioned the digital disparities, right? Well, thinking about how younger people may be surrogates or conduits to get information to others. There's a whole, in our pockets, we have access to all the information in the world, right? But not everybody has that information. So helping, maybe training young people and how to be, work with people who may not have access in their families and communities.
One thing also, when I was with the Los Angeles County Department of Public Health, we worked extensively with the County Office of Education and some of the supervisors in the school districts. And one of the campaigns we put out that was basically for children, again, going back not only for helping in the school, but to their parents, was the Cover the Cough. You may have seen that, with the idea of we called it the Dracula move, coughing into the sleeve. But we put that out with child-based education that then not only for helping transmission in the school, but also for going back to parents.
Great. Any questions in the back? Please. Yes.
So this is probably a question for all three of panelists. The reason why we are seeing the AI responding very positively to that question, whether you should vaccinate or not, is actually because OpenAI, they kind of like hard-coded for those questions. So for a conscious companies, they actually kind of like supervise all the AIs, and they hard-code those questions, and they kind of like force the AI to give you positive answers. Whereas we are also seeing like other, the whistleblower of the Meta, the previous Facebook, some of their algorithms actually is more for the profit, so they will purposely show you more false informations if you like to see more of those like false informations. So I think my question is, first, are there any, and the first question is, do you think those kind of like government regulations and government supervisions are a necessary step to regulate, especially for the social media and the AI? And the second question is, are there any studies, because one of the studies, one of the panelists showed before is that social media has basically no effects on protective steps on COVID-19. But I noticed that some of the social medias, after pressure or something, they start to have like a small tag on any COVID-related or any climate change-related questions. They will post a tag, be like, oh, please refer to CDC for more accurate information. So I'm just wondering, are there any studies showing like, post and like pre and post after, I don't know, are those like government regulations or those like platform self-motivated actions? Well, after this kind of like, I don't know, like tags, all those like protections, are there going to be positive influence, or are we going to see more positive influence from social media as a communication tool? Thank you.
Yeah, that's a great question. And so just to respond to that, with the AI, some of you may have read the news, Elon Musk is coming out with his Truth GPT. So we may see a different response to a question like that. And so I think it's really, really an important issue for us to deal with, because even if we pass a regulation, it's going to depend who's in power. Great. We can pass a regulation, we're going to have an election, and there's going to be a new law. So I really do think that it's important for us as public health professionals to not just rely on those types of regulations. And from my understanding, some of those kind of guardrails on social media were effective because people who want to find out information about conspiracy theories and think a warning like that is part of it. I mean, they're Uncle Nick. I mean, we're not maybe going to convince him, right? But there's all these people in the middle and all these people on that spectrum, even if they're kind of leaning that way. And those are the people that we might be able to convince. And again, I think it's about transparency, getting the message out, and finding a way to do it and meet people where they're at. So
I think there's a great opportunity right now to work across disciplines and train across disciplines as students, as trainees, and to further go in your career and work at these industries, work at these companies, and make positive promoting health information profitable. That could also be a thing.
That could be a tagline. Make it profitable. Make public health profitable, right? Okay. Unfortunately, we are out of time. This subject was such a hot topic that at the recent ASPPH, there was an entire plenary session around this, as well as breakout sessions. So if you are interested in learning more, I would direct you to the ASPPH website. Please join me in thanking all three of our panelists, Professor Robert Kim-Farley, Professor Massey, and Professor Garfin. And at this point, I'm going to turn it back over to Dr. Masinko. Thank you.